Seniors, before you decide this is just another video, do this quick test with me right now. Sit down, place your feet flat on the floor, and tap your calf lightly with your fingers for 10 seconds. Then stop and place your hand on that same spot. Now slowly lift your heels up and down 10 times. Stop again and feel your calf. Did you notice a little warmth, a pulse, or a light tingling? That small change matters. It means your circulation can still respond. It just needs the right kind of activation. After 60, the problem is not always the heart. Very often, it is the loss of muscle activity in the lower legs, especially the calves. These muscles work like a second pump that helps push blood back upward. When they get weak or inactive, blood moves more slowly, and that can lead to heaviness, cold feet, swelling, or tired legs when walking. That is why general advice often falls short. Walking more or staying active helps, but it does not always target the exact muscles that control circulation in the lower legs. That is why these short Japanese-style movements can be so helpful. They are simple, targeted, and designed to wake up the circulation pump in your legs. The first movement is the ankle circle. It looks simple, which is exactly why so many people ignore it. But your ankles contain a dense network of small blood vessels that act like a gateway between your heart and your feet. When those areas become stiff, blood can start pooling in the lower legs instead of moving back up properly. To do this movement, sit in a chair, lift one foot slightly off the floor, and slowly rotate your ankle in a full circle. Make the circle as wide and comfortable as you can. Do 10 slow circles in one direction, then 10 in the other direction. Then switch feet. Do not rush. Each circle should take a few seconds. This gentle movement helps activate the small muscles around the veins and starts pushing stale blood upward again. It is especially helpful in the morning when circulation is usually at its slowest after hours of sleep. Try doing it morning, midday, and evening for the best effect. The next movement is the seated heel lift. This one targets the calf muscles directly, the same muscles many experts call the second heart. These muscles are essential because they help push blood from your feet and ankles back toward your heart against gravity. To do it, sit near the front of a sturdy chair with your feet flat on the floor and knees bent at about 90 degrees. Slowly press through the balls of your feet and lift your heels as high as you comfortably can. Hold for 2 seconds, then lower them slowly over 3 seconds. That slow lowering part is important because it creates a gentle milking action in the deep veins of the calves. Aim for 15 repetitions per set and about 3 sets in a session. Breathe with the movement. Exhale as you lift your heels and inhale as you lower them. That small detail can improve the result even more. If it starts to feel easy after a while, you can place a little light weight on your thighs, but only after your legs have adjusted. The third movement is the toe grip exercise. This one surprises many people because most never think about toe strength, but the small muscles in your feet are closely connected to circulation in the lower legs. If those muscles are weak, blood flow to the feet and ankles can be lower too. To do this exercise, place a small towel flat on the floor and put one foot on top of it. Curl your toes and scrunch the towel toward you, gripping and pulling it little by little. Keep going until you have pulled the towel under your foot. Then spread it back out and repeat with the other foot. Spend about 2 to 3 minutes on each foot. It may feel strange at first because most people have spent years wearing shoes that keep those muscles underused. If your toes cramp, pause, gently stretch them, and continue. For more challenge later, you can try picking up small objects with your toes. This helps wake up deeper foot muscles and can improve circulation even more. The fourth movement is the seated march. This one works in a different way because it activates the hips, thighs, and deep muscles near the major blood vessels of the legs. Sit tall in your chair with your back straight and feet flat on the floor. Slowly lift one knee toward your chest as high as is comfortable. Hold it for a second or two, then lower it slowly. Repeat with the other leg and continue alternating in a calm marching rhythm. Keep it slow and controlled. Do not turn it into a fast workout. The goal is not speed. The goal is circulation. Aim for 20 lifts on each leg. This movement activates a deep muscle that lies close to the main artery supplying your leg, and that helps push fresh oxygen-rich blood deeper into the tissue. Exhale as you lift the knee and inhale as you lower it. If it becomes too easy after a few weeks, press your hand gently against the rising knee for a little resistance. The most powerful movement is the breath press technique. This combines deep breathing with a gentle leg press and creates a stronger effect than either one alone. Sit in a chair with both feet flat on the floor, about shoulder width apart. Take a slow, deep breath in through your nose for a count of 4 and let your belly expand. Hold that breath briefly, and while holding it, press both feet firmly into the floor as if you are trying to push the ground away. You should feel your calves, thighs, and legs tighten together. Then slowly exhale through your mouth for a count of 6 while keeping that pressure. At the end of the exhale, release the tension and rest for a few seconds. That is 1 repetition. Do 8 to 10 repetitions per session, twice a day. This exercise helps your body release more nitric oxide, which relaxes and widens blood vessels so more blood can move through. Many people feel warmth spreading through their legs within minutes of doing it. For best results, do it in a warm room and try to practice at the same times each day. These 5 movements work together to support better circulation after 60. The ankle circles help wake up the lower leg pump. The heel lifts strengthen the calves. The toe grips reactivate the small muscles in the feet. The seated march stimulates the upper leg and deeper blood pathways. And the breath press technique ties it all together by combining muscle activation with deep breathing. The best part is that every one of these can be done from a chair at home without equipment. Start with 1 or 2, stay consistent, and add the others as they become easier. Your circulation can still improve. Your legs can still respond. They just need the right kind of movement. If this helped you, subscribe to Senior Health Tips so you do not miss more videos like this.